In this video, we'll be discussing how to professionally and safely remove even the most stubborn of wax from the ears. Hello, we are Lee and Lindsay, audiologists and founders of Regain Hearing in the southeast of England.
We put together a series of hearing-related information to help you, the consumer, make better informed decisions.
So if this channel's for you, go ahead and tap that subscribe button.
And don't forget to click the bell to receive a notification every time we post a new video. So did you know that earwax removal is one of the most searched terms on YouTube?
Oh yeah, of course I did. I'm an audiologist.
So when do we need to remove earwax?
So earwax may not look pretty, but it's actually incredibly important for our overall ear health. It's packed full of antibacterial qualities, it's protective, but sometimes it just gets stuck in our ears and doesn't make its way out naturally.
When the ear canal's functioning normally, what actually happens is that the skin from the eardrum migrates outwards and it carries the wax with it. But it's when we do things like pushing cotton buds into our ears, we can actually push that newly formed wax further into the canal where it can become trapped. And over time, it starts to darken, harden and oxidise. And that's when it becomes a real problem to remove.
Yeah, things like earphones, even hearing aids, when you push those into your ears, that can push the wax back. And that's when it just gets stuck in the ears and we have to intervene. Remember, cotton buds are for babies, not ear canals.
So how can you tell if you need earwax removal?
Well, there's a number of ways. We've actually narrowed it down to the 7 most common warning signs. General lack of clarity, dullness, feeling of fullness in the ear, sound localization issues. So you may struggle to tell where sound's coming from, especially if there's a blockage in one ear. General balance issues, feelings of dizziness, and maybe even vertigo problems.
There's earache, anything inside the ear canal if your ears feel full at all. Tinnitus, so an unwanted ringing, humming or buzzing in the ear that may have got louder. Excessive coughing, so if you've suddenly got the urge to sort of itch inside your ears or you feel that you need to cough. Then finally, excessively itchy ears, even combined with a smelly odour.
Nice.
So the good news is that these problems are actually temporary and they're easily fixed. And when we remove the wax, it can massively improve how well you hear and your quality of life.
Our preferred technique for wax removal is using microsuction. It's the safest method to gently suction the wax out of the ear, as opposed to using water, like in the past, when they use these old-fashioned syringes, which were quite high-pressured and could be damaging to the eardrum. So we want to minimise risk when removing your wax. It should be performed by a qualified medical professional using specialist equipment to perform this, and it should be pain-free.
So some people try to remove the earwax themselves at home, and while they may be successful, it's usually quite tricky and it's often better to leave it to the professionals. So the best thing you can do is actually use olive oil, which is very gentle to the ear canal. There's no harsh chemicals inside it. What it actually does is help to emulsify the wax, making it easier for your medical professional to remove when you come into clinic.
There's all sorts of things on the market. You sometimes see it on social media where someone will appear this magic remedy for wax removal, and it doesn't always work. In fact, you get very mixed results with this. Best plan really, best advice, don't attempt to remove it yourself. Like we said earlier, cotton buds just push it back in again, and it's going to make it harder for whoever tries to remove the wax to get it out your ears. Best advice really, just leave it, get somebody else to have a look and remove it for you.
So there are other methods of earwax removal that we would use in clinic, aren't there?
Yeah, sometimes we see all sorts of things in ears. We see insects, beads, various foreign objects that need removing somehow, and microsuction won't always latch on. So we may use instruments to do that, irrigation maybe.
So we use a bottle method, which is very gentle, it's low pressured, and it has jets of water that will spray outwards rather than directly at the ear. And it's really useful when, for example, we've got wax dispersed in the ear canal and it's just simply too tricky to remove with suction every single piece. Or potentially if you had very hard, dry wax, it's useful to soften it as well to make it easier to remove.
So that's our video on microsuction wax removal. Thanks for making it this far. If you have any questions for us, please do leave them in the comment section below.
And if you found the video helpful, please click the like button. And if you want to see more videos like this one, please hit the subscribe button below.
Check us out on regainhearing.co.uk. Thanks for watching. See you next time.